Hello, my name is Michelle Cunningham, and I chose case study number 10, dealing with a 17-year-old girl named Tina, who doctors believe may be showing symptoms of Wilson's disease. Gene and chromosome affected. Wilson's disease comes from a mutation in the gene ATP7B, and there have been over 300 mutations found so far. This mutation can be found on chromosome 13. Disease etiology, cause or origin. Wilson's disease is a toxic buildup of copper in the body and is caused by an autosomal recessive genetic disease which occurs in men and women. The mutation is in the copper-binding adenosine triphosphatase, ATPase, which is responsible for excreting excess copper from the body via stool. The defect is what leads to the toxic buildup of copper in the body. Incidence of Wilson's disease. How often does it occur? Wilson's disease is known to appear in about 1 out of every 44,000 births. Pathogenesis. In order to get rid of excess copper from the body, it is excreted into the bile, which then comes out in stool. When there is a mutation in the ATP7B gene, it can lead to a disruption of the elimination of excess copper by the biliary excretion, leading to toxic amounts of copper building up in the body. The excessive amounts of copper can build up in the liver, causing liver damage. Copper can also accumulate in other organs of the body, and besides the liver, the brain tends to be the most affected. Phenotype. Wilson's disease can cause damage to the liver, causing a patient to get liver diseases like hepatitis, acute hepatic failure, and chronic cirrhosis. The damage to the liver can also cause the patient to have jaundice. Some neurological side effects of Wilson disease are behavioral differences like mood swings and abnormal behavior. Some people may even suffer from an altered reality and have delusions or hallucinations. Other symptoms are slurred or hypokinetic speech, tremor, dystonia, incoordination, and dysphagia. People suffering from Wilson's disease often have an eye disorder called Kaiser-Fleischer rings, that is a ring around the iris caused by excess copper in the body. Another symptom of Wilson's disease is low serum concentrations of the ceruloplasmin. Finding a diagnosis. Genetic and medical tests. In the article I read, the first thing they list as being key to an early diagnosis is having a knowledgeable physician who recognizes the patient's symptoms. There are some screening tests that can be used in order to help determine the possibility of the patient having Wilson's disease, including complete blood count, serum copper, serum uric acid, 24-hour urine copper, and blood ceruloplasmin. MRI, CTs, and X-rays may be used to help diagnose. Your physician or ophthalmologist may look at your eyes for evidence of Kaiser-Fleischer rings because it is seen in a high percentage of people suffering from Wilson's disease. In some cases, they may do a liver biopsy to test for high levels of copper. They do not commonly use DNA mutation testing on Wilson's disease because there are so many different mutations. In some cases, they are able to test siblings using a DNA haplotype analysis if there has been a diagnosis with an established index case. Disease management. Treatment of Wilson's disease. They commonly use 3 different drugs in the treatment of Wilson's disease. Zinc is used because it binds to the copper in foods, which prevents the absorption of the copper in the food, reducing copper levels. Trintine and penicillamine have chelators that bind to the copper and increases your urination. So you pee out your excess copper, which decreases your levels. In cases where the person has suffered severe liver damage, they may have to have a liver transplant. Is there a cure for Wilson's disease? There is not a cure for the disease, but it is treatable with medications. Treatment issues. There are some treatment issues pertaining to the medications they use in the treatment of Wilson's disease. Although penicillamine is often used in the treatment of Wilson's disease, it has a 50% risk of permanent neurological damage associated with its use. Trintine has a 20% risk of permanent neurological damage associated with its use. Zinc has been proven to have less of a risk for patients, but it can take 3 to 4 months for it to regulate the copper levels in the body, which may be too late to stop some of the side effects from becoming permanent. Inheritance risk for Wilson's disease. How is Wilson's disease passed on? The disease is passed on if both parents carry one genetic mutation in the ATP7B gene that they pass on to their offspring. Full siblings of a person affected with Wilson's disease have a 25% chance of getting the disease themselves. Case study information and conclusion. Description of case study. Tina is a 17-year-old girl who up until a year ago was a perfectly healthy child. 1 year ago she had a case of jaundice that lasted for 4 months that resolved itself. Tina has now come into the outpatient clinic with the following symptoms: mild jaundice, yellowing in the whites of eyes with evidence of Kaiser-Fleischer rings, a lot of different neurological symptoms, and an enlarged and non-tender liver. Conclusion. Tina is displaying a lot of classic symptoms of Wilson's disease. In order to come up with a complete diagnosis for Tina, they need to obtain a complete family history, complete medical testing, as well as genetic testing if possible. It is important this is done right away in order to stop the damage to her body before it is irreparable. This is an interesting chart that I found online that shows different parts of the body that are affected by Wilson's disease.